The epidemic we have in Ohio is fueled primarily by the pain med problem. We think about 3/4 of the people who, at least 3/4 of the people who are on heroin started with pain meds.
Are addicted. How did we lose control of opioids, and how do we get the epidemic back in the bottle? Jim Axelrod spoke to one of America's most prominent doctors.
This has been one of the great mistakes of modern medicine.
Dr. David Kessler, who ran the FDA from 1990 to 1997, doesn't hold back when talking about the explosion in opioid use in the last 2 decades.
Who's to blame? FDA has responsibility, the pharmaceutical companies have responsibility, physicians have responsibility. We didn't see these drugs for what they truly are.
From 1999 to 2014, sales of opioids quadrupled in the U.S., and so did the number of opioid-related overdose deaths.
There was a notion that pain was the 5th vital sign, that you wanted to relieve pain, that was essential. You dosed until the pain was alleviated.
That, says Kessler, was a costly mistake. 78 people now die each day from overdosing on painkillers. But the CDC didn't issue prescription guidelines until this past March, recommending doctors try over-the-counter pain meds before prescribing more limited quantities of opioids, but not mandating they do so.
Given the fact that this country is in the middle of a crisis, are these guidelines strong enough?
We'll say, this is an American condition. This is an American disease.
And look at the degree to which prescription opiates are causing deaths in our state. I would submit to you that there is no comparison, that this particular addiction epidemic presents a significantly higher threat than any other form of addiction that we've seen in recent past.
And I heard about an increased number of deaths from opiates, now exceeding, with prescription opiates, deaths from heroin and cocaine combined. I heard from our Birth Defects Center about more babies being born at risk for congenital heart defects because their mothers had been taking prescription opiates. I learned about more falls among the elderly who were taking prescription opiates, about more drugged driving crashes. And just about the only mortality statistic getting worse is the increase in death from prescription opiate abuse. This is a major public health problem, and it's getting worse and getting worse rapidly.
And this is a sentinel health event. We are awash in opiates. We have not got right the balance between risks and benefits. By all means, for palliation of someone with cancer, we need to treat their pain. But for chronic pain, back pain, headache, you'd be hard-pressed to prove that the benefits of prescription opiates outweigh the risks of what are clearly dangerous drugs. A few doses result in addiction. A few doses too many result in respiratory suppression and death. Over the past 10 years, 145,000 Americans died from overdose from prescription opiates.
I need help to find the people, to find the support, to find the resources to change this. Because if the right people are dying, it's going to be in your neighborhood tonight, tomorrow, next week, next year. You're going to know somebody close. It's going to be your son. It's going to be your daughter. It's going to be your husband. And you're going to be in my spot. Don't wait till then.